What's going on, everybody? Hope everyone's doing well. Welcome to this month's Adult Day Pro webinar. And I know, you know, for a lot of you guys that have been on this call, you might know how it operates. For those that might be new or first-time visitors of this call, just to kind of go over some of the housekeeping items. My name is Kris, the founder of ActivAge. And we do the call every month. I know we were supposed to have this call last week on Wednesday at 6:30, and my apologies for the last minute rescheduling of this, but I had a kind of an emergency come up that I had to take care of, and so anyways, I'm glad we could at least get together today. We may have a little bit smaller group because of the fact that we're on a different day than we normally are scheduled to be. But that'll give everyone here who does join a little bit more time, which is great. So, that being said, again, just kind of as a little update or reminder, the first 10 minutes here, so between now and 6:40, to allow enough people to join the call, we'll do a few introductions. So during this period of time over the next 10 minutes, don't ask your questions yet. Instead, what I'd love for everyone to do is introduce themselves, share maybe what area of the country you're in, and maybe what stage of the journey you're in. And then that way we can hopefully maybe connect, or at least you might come across someone or meet someone on this call that you can connect with that is in your local area or maybe in your state, and you guys can work together through some licensing questions or some other things after this call. So that being said, whoever would like to go first, again, introduce yourself, your name, where you're from, and what stage of the journey you're in. And then around 6:40-ish, we'll get into the live Q&A. And then for those that have questions that they would like to get answered, definitely make sure you put your questions in the chat. We'll go through the chat in the order in which that we receive questions. So the first people to put their questions into the chat now will be some of the first people to be called on. So definitely put your questions into the chat box, and then I'll go in the order in which you guys get them in there. It's funny because I'll say that now we might only have like one or two people that ask questions or actually put them in the chat. And then as soon as we start getting into it, everyone starts adding them. And then we don't always get through them all. So if you have an important question, definitely put it in the chat box now, and it'll at least secure your position to discuss or talk through that question that you might have. So that being said, whoever wants to go first, introduce yourself, where you're from, and what stage
Hello.
of the journey you're in. Hello.
Hi, how are you?
Good. How are you?
I am fine. I'm Nancy. I am from Massachusetts. And right now I am in the process of opening an adult daycare. I just received my a letter from the DPH for the last recommendation for before the surveyor comes to for the
Site
what do you
visit?
call it? Visit.
Yep.
So but I'm excited, but also I am so much not ready. And then I will ask you the question when I when I'm ready.
Okay. Well, feel free to throw it in the chat there, Nancy. I'm glad you're here. I know, I believe you're a returning guest, so glad that you could be on this call again. And congratulations on the stages that you've overcome and the stage that you're in now. So I mean, that's a big accomplishment too. So kudos to you for that. And
Thank you.
look forward to answering your question or diving deeper into some of your questions you might have. So whoever's up next, feel free to introduce yourself. We got Massachusetts in the house representing.
I'll go
So
next.
okay, go ahead.
So my name's Alexia Humphrey. I am here in Tennessee. I am not in the process yet. It's just been a new idea of mine, and so I want to open in the next 2 years. That gives me a time to build up and make sure I have all my processes in place and scouting places and stuff like that. So yeah, and that gives me an opportunity to finish my master's in social work.
Oh, fantastic. That's awesome. And who else do we have on the call that wants to introduce themselves?
I can go.
Go
Hello.
ahead. Yeah, and
Yes.
I mean, where are you from?
Yes, my name is Aminata Juf. I'm from Dallas, Texas, in Fort Worth, actually the Fort Worth side. So I'm actually been in the process for a long time. So I already have my the initial. Basically, they came and did all the surveys. I'm just waiting for the survey, but it's been so long. So they did the final initial since February, and I'm still waiting on the survey to come for the health survey. And my request was to see, because it's been almost a year now, to see if there is someone out there that wants to partner or that I can talk to see if I can, because everything is done, the building is done, everything is ready to go. But in the state of Texas, I guess they are short staffed. We're not having people doing the final survey. So I'm like in a limbo part right now.
Well, it sounds like you've done a lot of work.
Yes,
So
everything is pretty much done. The office is set up. I'm just waiting. They said we can have 1 or 2 people, but what I'm having a problem is because I have to contract with Medicaid, or even to get the assisted living facilities or places that I can partner with. I have to have the license. Everywhere I go to get, basically to bring new clients in, they require the license, but I'm in the limbo part right now without.
yeah, that's always the hardest part, so is waiting on the state to get that license,
Yes.
Well, I mean, if you have any questions that you'd like to dive deeper into, definitely put those in the chat box, and we'll get it into those shortly. We probably
Yeah.
have another maybe 3 to 4 introductions if anyone else wants to introduce themselves. And is it Amanita? Did I pronounce it right?
Yes, it's Aminata, but you can call me Amina.
Amina, okay. And where were you located again?
I'm in Fort Worth, Dallas,
Fort
Fort
Worth.
Worth. Yes.
Yep. I lived in Keller, Texas for a while. For about 6 months. I didn't survive. The beaches in Texas, they're not like the beaches in Florida.
Oh no, it's not like that at all.
So we lived there for a little bit. Everything is bigger in Texas. The food was great. A lot of great Texas hospitality, but I missed. I was a little homesick and ended up coming back to Florida, but that was like shortly after college there. So, but I'm glad
Oh,
you're here, Amina, and I look forward to diving deeper into your questions. And so if you have any specific ones that are burning, definitely put those in the chat, and we'll go to the next person here.
thank you.
Hi, it's Diane.
Hi,
Can you
Diane.
hear
How are
me?
you? I can
I'm
hear you. Yep.
great. I'm great. I've been here many times before. I have my location. I started all the work. My spot is huge, but my main concern is I stopped everything because with this new president and administration, I'm supposed to be all Medicaid because in the rural area I live, I have about 80% Medicaid patients. And elderly
Yep.
patients that have nowhere to go. Now, with Trump wanting to stop Medicaid, I'm like, okay, if I open this business in 5 years, I got to close it. So I'm scared. I don't
Right.
know which direction to go. I still
Well,
have
definitely.
the location.
Definitely put your question in the chat, and we'll certainly dive deeper into your specific scenario. And where were you located at again?
I'm in New Jersey.
New Jersey, and you have the space already in your
I
license?
have the space. I have so much going on. I'm cleared for everything.
Yep.
I have a final inspection that's supposed to take place. The place is not finished, but it's like a two-part place. And I'm also going to have, I planned to have physical therapy indoors as well, but
Awesome.
I'm scared.
Well, that's why we're here to support each other, provide some some insight, some answers to those questions, and so definitely share maybe some of your top concerns, and we'll dive deeper into those issues. I know you kind of mentioned some of them, but if there's specific issues around those concerns that you have, we can certainly dive into them in a lot more depth. Just make sure to squeeze those questions in the chat, and I think we'll do maybe 2 more introductions, and then we'll dive into the Q&A. One more
I'll
person.
introduce myself. I'm Kendrick Taylor. I'm out in Grand Prairie, Texas, in the Dallas-Fort Worth area.
Man, look at all these Texas folks
Possibly
representing.
looking to jump into the adult day center model. Currently own and operate a care patrol.
Okay, fantastic.
Been doing that for the last 6 years.
So, you know Chuck
And
Bongiovanni and his wife?
I
I know
know
Chuck's
Chuck
not as.
very well. Oh, that's my God.
When did you start, Kendrick?
In 2020, actually, like 2 weeks before the world shut down.
Did you buy an existing franchise from a
No, I
previous owner, or
built it from the
build it?
ground.
Wow, awesome, man. Well, kudos to you, man. It's exciting. I mean, I think that the fact that you're already like plugged into the placement world is a leg up on the adult day side. So,
Yeah, and I work with day centers now, and there's an owner who is looking to maybe come into another market and wanting to partner. So just kind of wanted to learn about pro formas and things like that.
absolutely. Well, Kendrick, I'm glad you're here. I think yeah, there's a lot of great things going on in your world that I think will be very beneficial, and kind of just feed naturally into each other. So if you have any specific questions about the adult day side, definitely get your questions in the chat, and
Okay.
I'll do my best to try to get to yours as well. So but yeah, nice to meet you, and kudos to you for your success with Care Patrol, and look forward to maybe being a part of this next journey with you. So.
All righty.
All right, one more person. We'll do an introduction, and see. Do we have any more, Texas folks in the house? If not, you're somewhere
Yeah.
else. That's okay too.
Hi, I'm sorry. Can you hear me?
I can hear you. Yep.
Yeah, my name is Takia Newton. I'm sorry. I'm a nurse in Houston, Texas.
Okay.
Hey, all
All
my
right.
Texas people. And
Let's go. Let's go. Texas is represent. What's so funny about doing these calls is that sometimes you get like all these people from New Jersey, and then sometimes there'll be a lot of people from Florida, and so it's cool. Like because you never know who's going to be on and where they're from, and it looks like Texas is representing tonight. So you said you're in the Houston area, right?
Yes, sir. Yes, sir.
Okay.
And I'm just starting out. This is just an idea. It's been an idea for a long time, but I see now it's time to act on it.
Awesome.
And I'm
Well,
just here to learn. I'm a sponge, and I'm looking to absorb as much as I can tonight.
awesome. Well, I'm so glad you're here, and definitely, if you have any specific questions, kind of in that discovery startup phase, certainly put those into the chat. There are no dumb questions. We'll do our best to get through as many as we possibly can, but we definitely go through them in the order in which they are in the chat. Sometimes at the end, I might as like a little bonus at the end, just call in someone that we didn't get to, and see if we can talk through it. So we might go a little long. Every once in a while we go 10-15 minutes over. But that being said, guys, I'm gonna go ahead and pull up our chat box now, see what kind of Q&A we got going on in here, and I'll let me see here. It looks like we got Kris Statham. Are you on?
I am.
Hi, Kris.
Hi.
Feel free to share your question with all of us here, and then we can talk through it together.
Okay, so we have opened up. We've been open for a couple of months now, and we have one client,
And
and
where are
we
you
have
located at, Kris?
South Carolina. I'm sorry.
Okay. Yep.
Okay.
No, I'm just trying to put the puzzle pieces together. So
Okay,
South
you're
Carolina,
right.
got it. Yep.
Yes. So I have someone else that's doing the billing. So she's been submitting weekly for the claim. But
Yep.
however, we keep getting rejected because of the place of service. And it's not a place on there for adult day.
Now, are
So
you billing Medicaid?
yes,
Are you
Medicaid,
okay?
yes.
Okay. So in South Carolina, do you bill Medicaid through the state directly, or do you bill through a MCO, a managed care organization, like an insurance company that handles the Medicaid payments for the state?
No, we bill directly.
So you bill through the state of South Carolina directly, and
Yes.
so is it possible the person doing the billing for you, do they have experience doing billing for adult
They
day?
did. Actually, she does because we own another company and she's done billing before. But for whatever reason, she's been submitting for like 4 weeks now, and it keeps getting kicked back out. And she even contacted Medicaid, but they weren't very helpful in telling her why it was kicked out. And it has to do with the place of services. And she chose other. we got kicked out. She chose a couple of other things.
And
And
are you what software are you billing through? Are you billing like, you know, some states use a software for this, but
I do believe she's billing either on their app or
okay.
Phoenix, one of the two. One of the two. I'm not really sure because we use both of them, but I think it's their app through
in
there.
the state of South Carolina, do you get an authorization from the state that, you know, shows the billing code, the approved billing code, and then the approved, you know, frequency and stuff like that?
So we have looked back through paperwork trying to figure out if there was if there is a code, and we haven't been able to find one yet. So we're
So,
just,
but for that participant, do you have an authorization for them?
we do have an authorization, but the billing code is not on that particular authorization.
Huh. That's interesting. I mean, you know, you know, to me, it's weird that you would get an authorization that didn't
So
have
it's, I think
a
it's not really the billing code, it's the place of service
right.
code.
So gotcha.
Yeah,
So, and that's, I'm trying to think, that's a drop down menu. So you have like
right,
other, and then you have like, you know, there's different options, right?
right.
Like
There's
in the
tons of
home.
options.
Okay.
Yes, there's tons of options, but
So
we just
do
do
you,
not see adult day anywhere.
yeah. Do you know of anyone else in the adult day space in South Carolina?
Um, no, not really. We know of a company, but when I call, she wasn't willing to talk to me about it. So
Have you reached out to your association?
no, no. We've just
Okay.
kind of been picking and resubmitting, and this is our fourth week of submitting, and we've got rejected 4 times.
Right. So, you know, what I would do is, you know, I would reach out to your association. You know, I don't know if you're a part of it or not.
Mhm.
You know, but you know, even if you're not a part of it, you know, like the association itself is going to be just naturally inclined to try to be more helpful, you know, because they want your
Okay.
membership. I don't know
Hmm.
how strong the South Carolina Association is. I could be saying this and they may not be fully, you know, like it may be a you know, not as robust as some other states. But
Okay.
you know, there's going to be other people in your state that own adult day centers. I know you spoke to one. They said they
Hmm.
weren't very helpful.
Yeah,
You
right.
know, but you could call on 10 and 8 are going to be helpful, 2 won't. You know what I mean? So the likelihood of coming across someone that's going to be helpful is still, you know, pretty great. And I would try to, you know, discuss with someone that's doing this every single day for adult day, that has the experience, that can, you know, specific to your state. And for anyone on this call, like the reason why this sometimes can be a little tricky, and I may not have the exact answer, is because every single state, when you bill for Medicaid services, is different. Some states, like in her case here, you know, there is no MCOs or managed care organizations that are you know, sitting kind of like in between the state and the provider is helping to manage payments. Hers, you know, she's going directly through the state. Other states, you'll get approved for Medicaid through the state, then you'll have to go get contracted, you know, with a Medicaid managed care organization, and so every state's a little bit different. But I would definitely reach out to a couple other adult day centers, you know, see if you can find someone that is, you know, willing to, you know, be helpful. The associations are always a good place to start. You know, naturally people are just more helpful that are a part of the associations, because they're, you know, for the most part, all advocates on behalf of the industry as a whole. And then I would, you know, reach out to that individual and just, you know, try to find a handful of people that can kind of, you know, be your go-to individuals that might be able to assist when you're experiencing, you know, whether it's with this problem or future problems when it comes to billing, that have the experience with the billing side of things. Just until you get the hang of it and you can kind of figure out, you know, some of the quirks that are related to billing, because a lot of times the people at the state level may not even know what the proper thing to do is. But you go
Okay.
to another adult day owner operator or someone that is handling the billing inside of that other adult day center, and you know, they might have all the hacks and tricks that they've learned of things to do and not to do, you know.
Okay. All right.
So
Thank you.
I wish I could have been the solution for you. But again, every state's so different. If it was Florida,
Right.
I could talk in a lot more depth. But it being South Carolina, if there's anyone on this call here that is in South Carolina that has any familiarity with the Medicaid billing, maybe link up with Kris and you guys can start your own private chat and you could be of help. Or if you know other adult day centers in the South Carolina area, that'd be great and helpful to her as well. But definitely, reach out to them. It'd be great to, befriend someone and build that relationship. So that way in the future, you always have someone you can call on, for future issues too. So,
Absolutely. Okay. Thank
all
you.
right, Kris, we'll look forward to hearing the outcome of that,
Yes.
Nancy, we'll jump into yours and then we'll go to Bree.
Okay. Thank you very much. Actually, I was going to email you these questions. But
Well, let's start with like one or two and we'll see how far we get.
okay, I do have four. But they
We'll circle back to you at the end there, Nancy.
okay. So you want me to stay to the end or what?
No, I'm saying go ahead and share at least, let's
Oh,
start on your
okay.
first question. We'll see
Okay.
how long it takes and then we'll if we can get through a second one, we will. Otherwise, we'll, just save them for the end and I'll try to squeeze you in at the
Yeah,
end.
I don't think it's gonna be too long.
Okay.
But I received a letter from the DPH telling me that I need to they don't give waivers for director or slash OT. I don't know if I need both of them. And then dietitian and dietary staff. So I'd like to know if I have a contract with a caterer, would I need a dietary staff too?
Yeah. So,
Mm-hmm.
if you have a contract with a caterer, you're still going to need someone to oversee the dietary needs of your members, and then someone to ensure, because even when you cater food into the your environment, there's still going to be elements to food service that you'll have to manage. So like when a caterer brings their food in, depending on what type of food it is, say like it was soup, the soup would have to come in if it was already made somewhere else and you're bringing it in, that food's still gonna have to be kept at a certain temperature, while it's in the transition from the caterer to your kitchen to being divvied up to your members. So there's still gonna need to be someone that's appointed as like that food service director, the dietary manager to one make sure that safe food handling practices are in place and kind of be the overseer of that, and then two to make sure that the dietary needs of your members are being met.
And yeah, because we have I'm gonna start with a small adult daycare with
Yeah.
30
Well,
to
and the
some.
thing is, it doesn't mean that you have to hire someone separate. When we first
Mhm.
started our adult day center, I was the director, the activities director, the food service safety manager. I was all those things. So whatever requirements, your state has for each of those roles, there might be different ones that you need to get. So you'd have to get those things, and you more than likely are going to be able to be all those things when you're first starting out, or if you're a smaller organization, but
Oh,
you're still
okay.
going to have to meet the requirements of each one. It doesn't necessarily mean that you're going to have to hire someone, separately or individually to be those things. Like I said, when we first started out, the lady comes in, all right, who's your food service director? Me. Who's your activities director? Me. Who's your director? Me. So like I was all those things, and
Oh, okay.
that's common.
That makes sense. Okay. Then the second question, the surveyors are coming. They want me to schedule a visit for,
Yep.
but the renovation is not completed yet. I haven't even started. So I'd like to know, because I have the floor plan I sent to them. I'd like to know, do I need to let them come and show them what I'm gonna do before
No,
I
you
do
you
it?
you you want to be ready to roll when they come.
Or I need to be ready to go when they come?
Yep. Yep. Yeah. You want your renovations to be complete. You want the space to be set up as if you're ready to open the next day.
And then the challenge with that, the SBA loan want me to have the license before they give me the money, and I need
So
the money to
a
do the
lot of times
renovation.
that is just the SBA naive to the process of you becoming licensed. That was also an issue when we had our SBA loan. And it's a matter of working with the bank and helping to explain to them how the process works and what needs to be in place before you can submit a license. Sometimes the bank may need you to submit a letter of explanation to explain, the reason why you wouldn't have a license to submit to them in order to get the loan. And that might be something that, like, is as part of the contingency of maybe whatever final payment the loan or whatever amount is left or balance is left on the loan that is being say loaned to you. Maybe that last like $5,000 or last $10,000 might be contingent upon you showing them the license, but they may have funded the first 90,000 or 90% of that loan with that letter of explanation. But a lot of times it's just it's educating the bank on how the licensing process works, and why you wouldn't be able to have the license until these things are completed.
Oh, okay, I see. And then the last question, it's a finance question. So, for private pay patient, what would you advise me to charge them? Like
you know
for
it's
part-time and full-time?
Yeah, it's going to be really hard to say without like really knowing your market. But you want to be at least $100 a day or more. So depending on what your market looks like, and a good barometer of this, is obviously reaching out to other adult day centers. Maybe not right next door, but just in your surrounding area. Kind of get an idea, a feel for where they're at. Reaching out to your home care agencies, and if you call on different home care agencies that are part of a national franchise network. It'll kind of give you a barometer of what they're charging per hour. This is not like, exactly how you should always figure this out, but it could at least get you in the ballpark. As if, they're charging $40 an hour for home care services, and that seems to be about an average, from the home care agencies in your area. You could cut that in about half and times it by about 6 to 6.5 hours, and that might give you a barometer for where you could be. So for instance, like if home care agencies are running about $40 an hour, you're like, hey, if on a 6-hour day, $20 an hour, I could be about $120.
Okay, but the thing is,
So
also myself provide transportation for for their clients. So should I charge transportation separately from the service?
yeah, in most cases where you charge a daily rate, transportation will be separate, so you can charge a flat fee. But you'll definitely want to assess your transportation costs, to make sure that you can at least cover your costs. Transportation is never a money maker. It's a lot of times going to be a loss leader. Like you're going to lose money on money that you make on transportation, but you make up for it in people attending more frequently and maybe people attending longer or more often, or people attending that wouldn't be able to attend if you didn't have transportation. So I mean, we charge $25 per trip. Like if our Medicaid folks who come to us where their days covered by Medicaid or VA, like we'll charge $25 flat fee for one way. But because we're hourly, our transportation is included in our hourly pricing. But that it's different if you're going to go hourly versus a daily rate. If you go a daily rate, you'll probably just charge a trip charge for your transportation. If you go hourly, like like we do, we just include the transportation in our hourly rate. So instead of their sign-in time being when they walk through our doors here, their sign-in time is when they get on the bus.
Okay, okay. Thank you
All
very
right,
much. Yeah.
absolutely. All right, Bree, you're up next.
Hey, I am from Alabama and I have been thinking about starting an adult day hab for a while. But I'm just kind of like there are no real like specific guidelines on the state of Alabama that I've seen when I've researched, as opposed to like Georgia. So I was just wondering if you know anything about adult day programs in Alabama. It seems to not be very many in the state of Alabama after doing some research, but I was just wondering if you knew anything about the state of Alabama.
Yeah, I don't, I can't say that I've like studied Alabama and truly know, all the, laws and rules associated with it. I do know that a lot of states, not every state, has licensing requirements for adult day centers, which is great. It's good and bad. It's good in the sense that if there are no licensing requirements, you have kind of like the ability to find a place, renovate it, get it off the ground in a much, faster time horizon than if you did have licensing, because a lot of times licensing will cause a delay and prolong the period of time, from when you want to, or from when you complete your space and when you can actually open and start serving members. I don't know as far as um, the state licensing requirements. I would have to, when I think about what area of Alabama are you in?
I live in Dothan.
Dothan? Okay. Alabama Adult Day Associate. I was trying to see if have you ever looked to see if there's an association there?
No, I haven't. I don't think there is though. I've Googled or I've researched some stuff and I not that I've seen. Let me just say that. So I don't
Yeah, I
think
was
so.
just okay. Gotcha. I was just looking it up. Yeah, it doesn't look like there's an association in Alabama either.
Mm-mm.
But there is like alabamadementia.gov does have some information on, so alabamadementia.gov has information on adult day services, and then there's the Alabama Department of Human Resources,
Now
and
that document on the Alabama Department of Human Resources, I did see that, but that just basically that's the guidelines for the building, um, not like the guidelines for how to get started and things like that. And I do think that in the state of Alabama you don't have to have a license. I think I've read
gotcha.
that somewhere.
Yeah, so I mean, I would do a little more research about that, because if you don't have to have a license, then really you're there's and most states are not going to have a how to start an adult day center. They're going to have like the licensing requirements that you have to um you know uh meet in order to actually become a licensed adult day center. But
Mm-hmm.
like that's where, like, calls like this, going to our YouTube channel and kind of following along the startup playlist. There's a lot of content to like help you, go on that kind of startup journey to assess what you would need to do. But if there is no licensing requirements for Alabama, then really, you kind of have free reign to create the space and the environment and do what you want, and run the adult day center how you want, and you're not necessarily having to meet certain requirements that have been outlined by the state. Things that you would still want to take into consideration are probably zoning. So there might
Mm-hmm.
be certain zoning requirements. Most areas of the country, like, if they don't even have licensing requirements, they may not have adult daycare specifically in some of their zoning
Mm-hmm.
language. So that might be a little bit of an educational curve to different municipalities and counties, where you go to look at a space and you're trying to get confirmation from the zoning authority whether or not you could open an adult day center there, and they're like, we don't even have adult day center listed in our zoning booklet, and
Mm-hmm.
so there might have to be like some special exceptions where they give approval for this adult day center in this environment, even though maybe it's zoned, commercial or office professional or something else. And then maybe they put it under like an event space when you think about when you start thinking about like the requirements for bathrooms and the number of bathrooms, for the number of people that are there, and whether or not you need fire sprinkler systems and things like that. So there's going to be like, fire, zoning, Department of Health, and they're kind of overseeing certain elements of the physical plant space. and like, what would be required when it comes to, bathrooms, ADA compliance, ingress, egress from the fire standpoint, whether or not you need a fire alarm or fire sprinklers and things like that.
Gotcha. Now, let me ask you this. So, since Alabama does not technically require you to have a license, how would that impact the reimbursement through like Medicaid and things like that?
Yeah, so really, then that would be a separate question on the Medicaid side is going to seeing what the requirements would be to become to apply for your Medicaid license to be able to bill for Medicaid. So you would at that point in time need to figure out, does Alabama pay for adult day services in through their Medicaid program? If so, what is the reimbursement rate like, and does that reimbursement rate make sense for me to open or to invest in an adult day center? And then when you go through that Medicaid thing, you're trying to figure out, can I become an approved Medicaid provider without having a licensed adult day center?
Okay, gotcha. Thank you.
No problem. The next time we get on this call, Bree, maybe you'll have all these answers for me and you can educate me on Alabama.
Hopefully so.
All right. Yeah, no, I think, sometimes, and honestly, there's got to be at least one adult day center in Alabama. I'm sure there's more than one, but I would certainly, just, search the internet, go through all the different, Google pages and see what adult day centers you can find and start calling on the ones that do exist, regardless of where they're at in Alabama. I mean, that could be the furthest point away from you. But they're going to have insight onto, you're going to get information faster from those individuals in regards to both Medicaid and also, whether or not there is licensing and or there isn't licensing, or just, certain requirements that might be needed. But you'll, like I said before, you'll reach out to 10 people and 8 of them will be very responsive and helpful and be willing to take your call and answer your questions and talk with you. 2 may not, but you just got to take your chances. Keep on trying. All right, we're gonna go to Nicole. Nicole Simmons.
Yeah. So, hi everyone.
Hi.
I am in New York. I have been thinking about starting a daycare for a long time, but I just I'm still stuck on like doing the financials and like really just understanding like what to charge and a break even and stuff like that. And I think that's just kind of preventing me from moving forward.
Sure. Nicole, have you I don't know if you've seen the videos I've done before on the type of adult day center you want to open. Have you gone through that exercise?
Yeah, I have. So I definitely want to do a social model. Um, and I actually have I just went through um some like a post that you did from like the end of August, which was really helpful. I just found it like today and I was like, okay, this is what I needed.
What was that? What was
It
that
was
post about?
how much does it cost to start
Ah, yeah.
2025? Yeah.
Yep. I think you know, when you think about, like just, the type of adult day center you want to open, I always tell people this when they're in that kind of initial stage, like, knowing whether or not, you want to be social or a medical model, understanding if you want to be primarily private pay or government funded. So, and when I say that, I always got to make sure that everyone understands, because you are primarily private pay doesn't mean that you can't accept Medicaid, or if you're primarily Medicaid doesn't mean you can't accept private pay. I'm just saying that, your intention is to either go after the Medicaid side of things or the private pay side of things. And if so, there's a good chance that if you're focused on Medicaid, that more than 50% of your revenue is going to come through Medicaid sources. If you're focused on private pay, more than 50% of your revenue will come through that private pay source, even if you do accept VA and and Medicaid and some of those other things. And then, you know, do you want to start a for-profit or a nonprofit type of adult day center? And then, you know, what was the last one? We did medical, social, for-profit, nonprofit. Oh my gosh.
How big?
I can't. I'm drawn. I'm like. I spent too much time today around our members here. You know, the dementia's rubbing off a little bit. Dang, what was my fourth category? Gosh, it'll come back to me.
Yeah.
But anyways, those three are the primary ones. And when you identify as, you know, you think, okay, yeah, I want to be social. I want to be private pay focused. You know, oh, that was the other one. Young adult versus senior focused. You know,
Okay.
so because some people will come on this call and they might have maybe more of a focus on the IDD population, which is a completely different, the way you market, who your audience is, even sometimes the billing might be different for that section of the population. So, you know, am I private pay, social model, senior care focused, and for profit, or you know, whatever version of that you
Yes, that
are?
is it. Yeah.
Knowing that is the most important thing, because once you know who you are and what type of adult day center you want to open, then you can start creating financial models around that. You know.
Okay.
So when you think about your financial model, did you have an idea for whether or not you wanted to be more Medicaid focused or private pay
It
focused?
would be more private pay.
Okay. So more private pay, and then for profit or nonprofit,
For profit.
and senior focused.
Senior focused. Yep.
Okay. So yeah, so now you know who you are, and that's the most important thing. So really, the next step in that journey is trying to understand, you know, at the end of the day, like, you know, how much capital do you have to work with today? You know, and you know, is that an amount that you're willing to risk losing? You know, and is it, you know, sufficient enough to realistically get started? Without having to bring on a partner or getting an SBA loan. At the end of the day, when you think about leasing a space, renovating a space, carrying the cost of all of that, going through the licensing process, having enough money for marketing to get the word out there when you first start out. I've seen people do it on a shoestring budget, and it's an impressive accomplishment that they've been able to do that. A lot of times, in those cases, they may have started out as a nonprofit, so there was ways that they you know were able to get things donated to them, whether it was money or time and labor. Maybe it's a general contractor that's willing to pitch in, or maybe they worked with a church when they first got started so they could start utilizing an area of the church that might be accessible for certain periods of the day, and the church was willing to work with them and maybe not charge them rent but donate the space. And there's some creative ways to maybe get this thing off the ground and start generating revenue and start building a client list on a shoestring budget. But if you're going to go out and lease a space, whether it's 2,000, 3,000 square feet, and it's a smaller space, I'm just getting my feet wet, but there's still some renovation costs. There's still costs associated with going through licensing, carrying the cost of paying rent during the period of time that you're going through the licensing process. Getting the marketing out there. It's potentially hard to do that for under $100,000 in today's world. When you take all that stuff into consideration. So I think that's where people are having to get honest with themselves of, do I want to bootstrap this, and know that, like, hey, I'm gonna have to like get really creative on how we can occupy a space and get things donated to us, and again, whether it's time, or money, or whatever the case might be, or do I have money in my home that I can pull out in the form of a home equity line of credit, or do I have a credit card that has enough room that can get me the initial bump, or do I have a 401k that I can use to access some money to help get this thing kickstarted, and trying to figure out what that would look like. So for you to go through this exercise, Nicole, I mean, have you thought about like what size of space that you would love to have, and the number of people you would like to serve on an average day?
Yeah, I would. I did look at a few spaces, and they were about 3 to 4,000 square feet.
Gotcha.
And
And what was do you remember what they were charging for rent? You know, it may
it
have been a per
was,
square foot amount or,
yeah, it was 8,000 a month.
okay. Right. Just, for, some perspective, right? So 8,000 a month, you're probably gonna have first, last, and security deposit. So right, just, on day one of my
Right.
new journey in this venture, I'm already out, what is that, 16 plus,
Or
$24,000, right? So, that's not a, that's an expensive amount, right? And then it's like, can I negotiate rent abatement? If I negotiate rent abatement, can I get 3 months? Can I get 6 months? Like how much, can I get a tiered, plan? Because there might be a 6 month to a, 9 month runway for me to, renovate this space. Is the landlord willing to throw money at tenant improvement allowances? Maybe I can't get 6 months of rent abatement. I can get three, but maybe they'll throw in, $20,000 or $40,000 towards renovating the space that can help with the construction side of
right.
things. So those are things that kind of, ways to get creative. But more than likely on a space that's 3 to 4,000 square feet, easily you're gonna run up, to that kind of $100,000, $150,000, mark, um, to get something like that licensed and off the ground.
Okay. Okay, I figured it was around there.
I mean, and Um, and then really when you think about the number side of it, every state, when it comes to licensing, might have different capacities or ways that they would measure how you figure your capacity for the number of uh, members you can have, based on the square footage of the space. So you'll have to look at your licensing regulations to kind of see what that capacity is.
Okay.
But then whenever you figure out what that max capacity is for that area, and I think as a general rule of thumb, probably from a conservative standpoint, think about the average daily attendance that you could achieve if you were at full capacity, times that by 100 members per day if you're open 5 days a week. So it'd be like 100 times, say 50 members times 5 times 52 weeks in a year. You may want to take into consideration that you might be closed a certain number of days in that year. So you're going to kind of work backwards from that. But
Okay.
I always use like $100 a day as my general rule of thumb, when I'm calculating my, kind of projections I mean, ideally you want to be above that if you're private
Mhm.
pay, but at least that would be a good conservative guide to see like what type of top line revenue can this produce, and then you start backfilling in the spaces for your rent, what you think you might have as far as your roles, and who might play each of those roles. Is there a husband and wife couple? Are you doing it with a partner? Is one person going to handle operations while the other person does marketing, or you have to hire for those things? Those are going to have pretty significant effects on maybe your labor costs, and at the end of the day your biggest expense will be your labor costs. So everything else is going to be fairly inexpensive. The two things that'll be expensive is your rent and then your labor, and then everything else is going to be you know uh you know fairly manageable on top of that.
Okay. Thank you so much for this. This was really helpful.
Yep, absolutely. All right, next person we got. Is it Diane? No, yeah, Diane.
Hi again.
Hello, how are you, Diane?
I'm here. I'm here. So my question was about, with this new administration who wants to
Hmm.
cut Medicaid, and even, and the generation we serve is usually the elderly. They also want to cut their Social Security. I'm like, well, if you cut Medicaid, you cut in Social Security. How are these people going to afford anything? You understand? So I'm a little iffy. I was even thinking of going into because I have the location already. It's huge. It can do a lot. Child daycare. If because Medicaid is my main goal because the area where I am have, I mean, the population is just growing with the elderly that have nowhere to go. Some of them, as a nurse, I work in a hospital too. I get a lot of patients where they have to do emergency calls on them. The police have to go break down the doors and find them on the floor for a couple of days. They've been laying there, and you know, diseases come on, they get sicker. So they need a place to go. And I'm willing to do it, but with this new administration, with the cut of this Medicaid thing, it's scary to open a business and then and 5, 8 years later, you know, Medicaid can't provide funding for you anymore. So what are the
Yeah, so
outcomes?
it's like it's hard for me to speak on this in one sense because I've always felt like being reliant or relying on the government, for your business model is just a bad, not, I don't say bad. It's just that it has its pros and cons. Like
Right.
the hard part about it is like if we provide more services and we add more value to our members, and I want to pay my team more, and we want to start building in a cushion for benefit packages we want to offer them, I can't do that and build that business model on a Medicaid or government funded program, because at the end of the day, I'm at the mercy of whatever the government funding program is offering for those services. And so, we are primarily a private pay adult day model. And so it's hard for me to speak on behalf of, people who are like, Medicaid focused sometimes, because at the end of the day, like Medicaid is such a small percentage of our revenue every month that we've always treated that as a kind of like our way to give back to either our existing members who, have been with us for a little while that now go on to Medicaid, or for families that walk through our doors and ask about it. But we're not like advertising to people that we accept Medicaid. So it's something that we've always looked as a way to serve the community and give back to them, but not our primary focus. So I feel like you always have to be somewhat, conscientious of the fact that, Medicaid changes could happen, Medicare reimbursement changes could happen. There's always, anytime you're relying on a government funded source for your revenue, changes may happen, but it's hard to weigh what those changes are going to be and how much it's going to impact you, and until you're in the middle of it and it's actually impacting you. Versus, I remember, for instance, in the state of Florida, as we were coming through COVID, they had passed this bill for any Medicaid providers that were receiving Medicaid reimbursement had to basically fast track whatever the state of Florida minimum wage requirements were. Like, we already had like this tiered program where every year the state of Florida's minimum wage was increasing at $1 per year until it got to 15. And then, during the COVID era, Medicaid providers, some bill was coming out that said that like anyone that was accepting Medicaid had to pay their employees a minimum of $15 an hour starting October 1st. And if you didn't, you were going to be fined X. And the entire time leading up to October 1st, we're like, okay, well, if we're required to do that, what's the differential in our reimbursement that we're going to receive from you? And like, they didn't have an answer. And we went to every one of our partnerships that we had for Medicaid, and no one could answer the question. They're like, we don't know. And but the state of Florida says we have to do this. So October 1st, we made a plan to like raise everyone's, the minimum wage across our entire company to meet these standards, because even though we don't rely on Medicaid, but we're still a Medicaid provider. So by default, anyone in our team, had to go to this new minimum wage. And we had basically, this was like 2 years before our forecasted plan was going to go into effect. So it was going to impact us significantly. And we go through that entire thing, and then a month later, the bill never passed, but
Mm.
we had already made all the changes. And so I think that's the hard part sometimes with these bills or with these changes is what actually got passed, what actual impact does that have? Medicaid is so state dependent that even though some of these funds are coming from a federal level, how they get passed through each state and what the state chooses to do with those funds is going to be very different. And so I think it's hard for you to make a decision of, do I go forward or do I not,
Mhm.
just based on the fact that these changes are coming. I think that, if there's anything that maybe is working in your favor, because I believe you said you're in New Jersey.
Correct.
So New
So
Jersey has a great, like, they have a strong presence from a lobbying standpoint
correct.
in that area, you know.
Apart from that, I also looked at the private pay, and whatever Medicaid is paying is what I was going to charge for private pay as well. Plus,
Which you
veteran,
can do in New Jersey, but like not in Texas. Because if you're in Texas,
correct.
Medicaid reimbursement's $38, and there's no money to be made in adult
Oh
day at
no,
$38 a day.
I
Yeah,
couldn't pay attention with that.
yeah.
And
Sorry
apart
for
from
all my
that,
Texas folks on this call. You know.
apart from that, I looked into the VA. I put my application for the veterans also
Yep.
to accept them.
And that's
Um,
a great benefit. That one pays very
it,
well.
it pays very
Um,
well,
pays
but
for
my thing
transportation,
is
showers, all that stuff.
the patients that I have, even if they cut Medicaid, I continue to take them. They threaten to cut Social Security too. So what do they expect these elderly people to go?
I don't, the reality is that they can't cut these programs in a way that's going to like significantly impact our seniors, because they know there's a bigger crisis at hand here. Like that's why a lot of these, we're seeing more and more states come up with Medicaid programs that pay family caregivers to care for their loved ones, because they already know we have because the crisis is upon us. Like we're in they can't cut these programs, because then we're gonna have seniors homeless on the streets. And
Exactly. Hospitals closing, and
but I think
yes,
sometimes like there's this like the aura or the fear around bills and changes sometimes becomes way bigger than the actual changes themselves, you know. And so like to maybe get information that is directly from the source, and people that are walking through this, because New Jersey has a very robust adult day services association, I
correct.
would
It's
reach out to
strong.
them. Yeah.
I have, and
But
I-
talk to the providers. Like, what are the providers doing to insulate themselves? Are they concerned about it as of today? If so, how are they preparing for any changes that might come down the pipeline?
my providers, my doctors, who's willing to give me. I mean, when I tell you I have patients lined up, like from day one, I will be fully packed. But they're like, really, Diane, I don't know. It's iffy. It's a 50-50. We don't know what this administration is really going to do.
Well, I think that's what I'm trying to say is like it's really just making a decision of, do I take the flyer on not knowing what they're going to do, because you're never going to know what they're going to do from one administration to the next on how these programs might change. And again, it's so state level specific too, that but at the end of the day, like if you're hesitant, you might have to just wait for now, or you got to just take the flyer and roll with it, and
Mhm.
but they're not going to eliminate Social Security. They're not going to, eliminate Medicaid to the point where it impacts our seniors, so drastically that, the crisis that we're already experiencing becomes even worse. Because
Worse.
yeah, we're they're just not going to do that. Like we'd have much bigger, problems, if they did that.
I've also looked into
So
other countries. I was surrounded, sisters and neighbors. America has the
well,
worst healthcare plan, and that's
I
sad.
know
We're
it's
supposed to be
crazy.
the United States to unite to bring together, but we are the worst.
It's great. It is crazy, but I definitely reach out to your associations there, Diane. I'm gonna go on. I had two more questions I got time for, and then we're gonna
Okay.
have to move on to
Okay.
the we'll have to catch up with everyone here next month. But I guess let me go to is Amina.
Yes, it's Amina. It's Aminata, but
Okay.
everyone calls me Amina. Yes.
Yeah.
So my question is actually just how to move forward, because thanks to you, thank God, I started this process since last year, and I got the space and I negotiated the rent and I got some basically renovation and everything. But the process of getting the licensing is in Texas is crazy right now. So I got the initial. The initial, they came out 3 times before they passed the initial. So we got that out of the way. And after that, they said that that was done in, I think it was in February. And they said someone will come over for the health survey. And since till now, no one's getting. We call back to the licenses, and everyone is like, oh, we already put it in, we're just waiting, you're just waiting to come. So I'm at the point that, like I said, the carrying cost is becoming too much at this
Yeah,
point.
I mean, when you say the health survey, it's about, is this for like the Department of Health, or is this for like the licensing
The licenses.
survey?
So with the
Okay.
county that I'm in Fort Worth, so I'm in Tarrant County. So I already got the health, with the county, I'm already done with everything. I got all my permits from the county. It's just the licensing part, which is the health survey, that it's taken. I don't know if they're short staffed, because we sent an email to every single person, and everyone will like, okay, we're gonna escalate it. Someone will come over. Until this day, no one, because with the survey, no one is supposed to tell you that they're gonna come. They're just supposed to come in and do the survey, but no one is here.
Yeah, I feel like there's,
Well,
like parts of the story that I'm missing a little bit.
I'm
You know,
in I'm in Texas as well, and I can tell you that the survey right now, they're so swamped with trying to go out and visit, because you have to have the survey before you can officially open, and the
Yes,
right.
survey is unannounced.
exactly. Exactly.
I know in assisted living,
And Kendrick, the initial survey is unannounced as well. 'Cause
No,
I
the
know.
initial. Yeah, the initial, you mean the initial, like, check? If it's the initial, that one we did, we passed. Everything is done.
yes,
It's just a health survey.
yeah, that survey is unannounced, but I can tell you they are super
So
behind,
so
and
so they
you can
expect you.
expedite though
They expect
for a
you. So
fee.
you have. Okay, interesting. So Kendrick, where's that? What's that
How do you
expedition?
get that?
What's
How
that
do you get
process
that
called?
going?
So I know for the assisted living side, they have to do the same thing. So I think it's like $2,500 to expedite it. When you apply, you can ask to expedite it, and it's like an extra $2,500 fee.
Oh, okay. And how do you get that going? Do you go
Honestly,
back to the licensing?
I mean,
Like,
if I were you, because you said you had your initial in February,
yes, I did.
I would be camping out at wherever their
Yeah.
office is, and literally walk in the front door and be like I have spent my life savings. I've been holding this property, carrying this cost. I've spent X amount of dollars. I need an answer from someone here. I don't care what it
I,
costs, what I gotta pay, who I gotta talk to, but I would be camping out like I would have
I
lost my mind by
I
this point.
actually did that. I went to one of their offices. It's in Matlock, and they told me that it's not open to the public. Whatever we have to do, we have to either do it through email or call or go through, which is, we have a portal in Texas that you have to go through and submit it, which I did 10,000
I,
times.
I'd call like the newsroom and be like, look, like
I'm sure.
I mean, there's got to be some. I mean, listen, we go through the same thing in Florida. Okay, we got the same problems here in Florida. I mean, I'm not discounting what you've done. I'm just saying that I know that's the one thing I've find a lot of people get hung up on the licensing side sometimes is sometimes maybe a lack of follow up can cause these delays, and they're like waiting and waiting and waiting, and all of a sudden that person got put to the bottom of the pile because they're just they're not the squeaky wheel, and I got to figure out how to be the freaking squeaky wheel. I know when we had our we submitted our license, we had gotten approved for a survey in Florida in our most recent location we opened. And I remember I called, the office, I spoke to the lady, she, told me so-and-so, not here today, whatever. And I'm like, got their email, sent them an email, called the next day, talked to her again, just doing everything I could to figure out, okay, well, who makes the decision? Who sends the person out? Who's the, like the point of, like, I'm trying to get past this gatekeeper. Give me some insight as to who oversees my area, who surveys in my, in the Sarasota County area. And, I'm trying to like get directly to the source so I can send them an email. I can try to find their phone number online and actually get in touch with the person who's going to be setting this up or stamping the paperwork or approving that person to come out.
Yeah.
But
So
like February to today, like that's ridiculous. Like that
it
shouldn't
is
even be allowed.
It is, I know, and that's what they said, because we went, like you were saying, I spent weeks just researching emails. Who's the boss? Who should I talk to? Sending email to that person. And we finally got one person. I think her name is Deborah. And she said that, okay, we're gonna get this taken care. And she even said, are you sure it's been since February? I'm like, yes. And she was even surprised that it took that long. We thought that was gonna be the end. Someone will come the next day. And they said that we have to go back to the licensing department. And when we send the email, because you assign someone in the portal, and that lady said that because she put it in since February, we just have to wait till someone comes out. It's like
I mean, yeah. Sorry, it's like, all right, wrong person, next person. Who am I calling now? One, I go explore what Kendrick's talking about to pay for the expedited fee.
Yeah.
So I go re-explore. What does that mean? How does that work? Where do I pay it to? Can I add that now after the fact? Two, next step. Who do I know? Like that's a surveyor do any of my people in my senior care community know any surveyors or know anyone in that the department that they might be friendly with or friends of or have or closer to, that maybe I can get access to someone. And then three, if I'm not getting any progress, I would consult with like a healthcare attorney who deals directly with the state on these types of issues, like licensing related issues, because they're going to be more familiar with people in the licensing department, and maybe explore having to go that route.
Okay, so that's why I wanted to just come here. Anyone in Texas, if you wanted to partner, at this point, I am so frustrated that I'm like,
yeah. Well, I think you
just
seem like a very nice person. We got to take your frustration level to like the level where potentially bad words are coming out of your mouth, and we got to get to that like level of frustration and anger that where we can make a move somewhere. Someone's willing to help me out, so I think do what Kendrick said to learn about the expedition, or to get the expedited.
If I can please get your information, so to see how is it done through the state portal, like where we put the license in?
But if you guys want, just connect via chat real quick, on the chat.
Yeah, that's what I'm gonna do. I'm gonna just
okay.
I'm just gonna sit there and chat.
Okay, perfect. All right, thanks guys. Let's see here. I'm gonna do Miranda is next, and then if I don't know if Jackie, you're still on. Jackie, I feel like has asked me a question for a long time now, but I just am getting to it next. So Miranda, I'll go to you, and then I'm gonna go to Jackie. We're gonna run a little long. If you guys have to hop off, I understand, not a big deal, but I'll try to at least get to Jackie's question, and then we'll wrap up there. So Miranda, if you want to go up next real quick, and I'll see what I can help out with.
Hi, Kris. Can you hear me?
I got you. Yep.
Yes. My name is Miranda. I live in Houston, Texas, and I'm at the very beginning stages. Like it won't be for
you're gonna be able to learn from Armina here,
Exactly. So they already scared me with this licensing thing, That's
well, she'll be a pro by the time you get to that point, so she can tell you who to call.
I am a pro now. I know all everyone on the list.
Right.
Trust me.
You guys definitely need to connect. But yeah, go ahead.
So the only thing I was wondering, because I looked at all your videos, and I know I want to do for profit. I know I'm going to rent a space, but do you charge a different charge if you wanted to do a medical adult daycare versus a social, or it's just up to the individual daycare?
Yeah, I think it depends on what your state requirements are. If you go to the medical model, do you know for Texas, what are the different requirements for social versus medical? Is that clearly defined in your area?
I don't think it is, because you're the only person that's really talking about it a lot, and I've called like one other adult daycare, but they're all social. So
yeah, so not every adult day center, or not every state has a separate license for medical versus social. Sometimes that terminology can get a little, kind of just, for instance, in Florida, when I think about our model, I mean, we are primarily this like social model, right? Like the majority of what we do is social, but the medical elements of what we do are like personal care, dementia care, medication management, assistance, with showers, and people helping to and from the restroom, transferring in and out of their wheelchair. So these medical components don't necessarily mean that like we're doing physical or occupational therapy. In the state of Florida, we don't have a medical versus social. The thing is some states you might be able to go a social model and not have to get licensed, and then the state would consider a model where you might do medication management or provide personal care. They may consider that model to fall under a medical model, which would be a licensed adult day center. So sometimes there are a lot of layers to those two types of models. At the end of the day, when I think about a private pay model serving seniors, the majority of the people we serve that are willing to pay out of their own pocket for services are going to be folks that have some stage of probably memory care issues. Like 60-70% of our members are going to have mild dementia, Alzheimer's, Parkinson's, and then maybe about 30% of them are more advanced, later stages of Alzheimer's, dementia. But the reason families are willing to pay for our services or spend $1,500 a month, or $3,000 or more a month for them, is because there's an underlying need, and typically that's related to some sort of memory care need, which by default is going to mean that we're going to be providing personal care, helping someone to and from the restroom, helping with toileting, potentially helping with meals and eating, helping with maybe transferring in and out of a wheelchair, and things like that.
Okay.
And
Yeah.
so, as far as the way we charge, we don't charge like a separate price for our independent, person who drives themselves. And trust me, that person that drives themselves to your adult day center is a very rare member. Like that's not as common, but that person pays the same as the person that needs full-blown care. The way we do our pricing, and where someone might pay less, for our services, is if they're on a monthly membership plan. So they're committing to us, coming to us maybe 3, 4, 5 days a week. And because of the frequency of their attendance and how much time they spend under our care, we offer discounts to incentivize people to come more frequently.
Okay, I understand. And I'm listening, so I don't have any other questions because everybody else is teaching me.
No, it's great. We're all here to learn. This is, I always love the variety of questions, and I think everyone can learn from each other on these calls. So they're great. I'm gonna go to Jackie because if she's still on, I know she's been patiently waiting to ask this question. Feel like so want to get to you, Jackie, and then we'll wrap it up. Again, I know we're over time, so if you guys got to go, it's no big deal. I completely understand. But if y'all want to stay, Jackie, we'll end it on you. Maybe Jackie already left. I thought she was still on. Oh, yeah. Jackie, you there? All right. Give it one.
Jackie said no.
I know. She's like, you waited too long, Kris. I'll try maybe ask you to unmute there, Jackie. In the meantime, let's
Hello,
see. I was
sir.
gonna.
Hello, sir.
Hello?
This is the Daya, and if you have a few minutes, I have to ask you something. I'm in Florida.
Okay, yeah. Go ahead. I was I was gonna see if Jackie was on real quick. Let me see. Jackie, did you ever get your? I see your mic's unmuted, but I'm not sure if it's working or not. And if not, we can go to the next person. Go ahead.
So we are very begin, and I'm from Polk County, and I'm just looking at space. So tomorrow I have to go and see it. So I'm looking for like 6,000 square feet. So how many people they approve to I can go for daycare, for adult daycare?
Yeah, so on 6,000 square feet, it'll depend on your usable area. So like, depending on how you set up your floor plan with restrooms and administrative offices and other, and like say the kitchen, If you like eliminate the kitchen, eliminate the bathrooms, eliminate the administrative offices, the square footage you're left with, eliminate the utility room, the usable square footage you're left with will be what you can work with to kind of come up with your capacity. But for those that are 6,000 square feet, I always say a safe bet for a licensing capacity would be anywhere between 50 and 70 people a day.
Okay. And then second question is how harder and how easy getting license? Easy, a little hard.
In the state of Florida,
Yes,
I mean, licensing is never easy.
I know.
But I've done it so many times. So for me, it's easy because we've gone through 5 different, we've gone through a change of ownership license change where we sold a licensed assisted living facility. And then we've gone through 4 new companies, initial licensure. And so, with that experience, I would say that I feel like, for me personally and our team, we know how to navigate that really easily, but it's only because we've done it so many times in Florida. I think if you're doing it for the first time, it can be a little intimidating, a little confusing, and there can be some frustration around getting licensed.
So it's like having a time frame like 2 months, 3 months. They take you for everything is settled down and good to go. They take you
Yeah,
for.
so in the state of Florida, from the day that you submit your application to the day that you finally receive your license, if you did everything perfectly and you absolutely crushed it, it's probably at a very minimum, it's going to be 3 months or 90 days.
And last question, sorry to. And when like 3 months to license, after license,
If you are,
Medicare.
if you're doing it for the first time, it could take probably, maybe 4 to 5 months, maybe 6.
First
So
time we are doing.
yeah.
First time we are
Okay.
doing.
So I would bank on at least 120 days, plus or minus 30.
And then after start 6 months, then Medicaid gonna start it, right? Example like United, like health, any like insurance start.
Yeah, so
Medicare.
for you to be, yeah, so once you get your license, then you can immediately apply for Medicaid, and that process will be a 2-step process. So first, you'll apply for Medicaid through the state of Florida to become an approved Medicaid provider,
Mm-hmm.
and that process could take 30 to 30 days, 60 days, depending on just the familiarity with navigating that process. And then once you do that, then you'll have to go through the approval process with a managed care organization. So managed care organizations are like insurance companies that are managing the Medicaid funds on behalf of the state Medicaid program, and you'll have to get an approval through them. So you'll first get licensed. Now you'll have your Medicaid, or you'll have your state license, your Medicaid approval, and then you'll go partner with companies like, say, Humana or United Healthcare through who operate as a managed care organization. It could be like a Sunshine or I'm trying to think of some of the other providers that exist, but and then that will have its own individual process. To go through the credentialing process, each company will be a little bit different as far as the time frame, depending on how backed up they are or how efficient they are, getting people credentialed. But then once you got credentialed, then you could accept Medicaid.
So it's nothing like a time frame like they take you 2 months, 3 months for after like.
Yeah, so I would say on the Medicaid side, a safe bet between like after you got licensed, you're probably looking at 30 to 60 days to get your Medicaid approval. You're probably looking at another maybe 2 to 3 months to go through your full credentialing process. So you're probably looking at somewhere in the neighborhood of 4 to 6 months after you got your state license to then start billing for Medicaid services.
So totally, I'm going to see tomorrow for space. So I have to make some money to ride rental because 6,000 they charge me $9,000 per month. So I have to prepare for money for until like 1 year almost.
Almost, yeah, because you're going to go through a construction period probably too, and so
Yep.
when you first start out, you're going to go through that initial process. Like it'll depend on obviously like how the space is set up, but if you did have to do construction, there's going to be that construction element. How long is that going to take? Then once the space is completely set up and it's ready to use as an adult day center, now we got to go through licensing and then get approved there. And then now we got to go apply for Medicaid. And so you're probably looking at least a year, potentially 18 months.
18 months?
Between the day that you sign the lease and the day that you accept your first Medicaid client, that 12 to 18 months is probably going to be your window,
Mm. And they one more I know, and one more for they give you for food and transportation also provide for Medicaid.
Yeah, so Medicaid, depending on the managed care organization, may reimburse for the transportation, and typically they'll just have a flat daily rate. They'll have sometimes they'll have a daily rate for adult day services, and then a flat rate for transportation. Regardless if it's just one way or both ways. And then when it comes to the food side, not through billing through the Medicaid managed care. You wouldn't bill through your authorization for food, but there are Medicaid programs that, if you're primarily Medicaid as a center, that you can apply for, and Medicaid will provide a reimbursement like, per person on your roster, and it's not a significant amount, but if you take a couple of dollars per person on your roster, it can certainly help offset the food cost.
Approximately for Medicaid, like Humana, Aetna, and how much per day they give for money for?
Yeah, so in the state of Florida, because it's a managed care organization that is managing the Medicaid funds, it is somewhat negotiable. But in my experience, it depends on the density of the area that you're in as to whether or not what it really is going to depend on, if there's a lot of adult day centers in your area, you may have a harder time negotiating a higher rate. If there's not a lot in your area, it's going to give you better chances to negotiate a higher rate. But in Florida, the average managed care organization or Medicaid, program is paying anywhere between 55 and 75 per day. But we do have some contracts at like 100 and 120 per day. But that, was a strategic move on our end to like actually negotiate with the managed care organization, for a higher rate. So not just accepting what they offer, but actually going back to them and negotiating for more.
Oh, we can do this? Okay.
You can. Yeah, you can in states that have managed care organizations where you have an insurance company that is, managing, the Medicaid funds, and you're basically getting credentialed with this insurance company. You bill for the services. Medicaid at the state level pays the insurance company pays you. So if you're in a state where that's the setup, in most cases, you can negotiate with them. Whatever they say it is, doesn't mean that you have to just take that. If you're in a state where the state itself is you're billing the state for Medicaid services, in that case, you're gonna have to just take what they offer. But in a managed care organization state like Florida, you can negotiate it. And sometimes what'll happen is you'll work with managed care organizations that might be new to your area, and they're willing to offer you a higher rate just to get the agreement with you, because they're trying to move into that area, and so they're trying to get a bunch of providers so they can go back to the state and say, hey, look, we have all these providers signed up, and get approved to serve that area. The hard part with those folks sometimes is they're going to be new to that market. So if they're new to that market, they may not already have a lot of people on service. So you may have negotiated a higher rate with them, but they may not be the ones sending you a bunch of referrals. Whereas you might have a Humana and Humana may be harder to negotiate with, but they might be the ones that have 80% of all your Medicaid referrals.
Gotcha.
You know.
Okay. Thank you, sir.
Yeah, absolutely. Well, man, a lot of great questions. Man, what a nice variety, and yeah, well, it was just a good call. I'm just glad we get to do this with everybody. So
If
super excited.
I
What's
can
that?
contact you, and then you can do all processing for license and those things.
Yeah, you know, there's definitely different ways that we can help. So just for anyone on this call, you know, if you needed more individual help or assistance, you know, just to provide some context, if you go to adcpro.com, you'll find on there, like, there's a section we have for coaching calls. So if you have an immediate question and you're stuck on something and you just want to talk through that issue, you know, and you know, we can spend an entire hour together, you know, game planning, talking through issues. I can share, you know, information and you know, send you, you know, maybe documents, P&Ls, or next steps. You know, we have coaching calls, which, you know, it's a low cost option that you could book right through adcpro.com for those one-off questions that you might have. You can, you know, purchase a package of them at a discounted rate. Those are great for, you know, one-off questions. But for, you know, something we can dive deeper in. We also have a consulting section that you can go to. I don't do a lot of consulting. I limit it to just two organizations at a time. And it depends on maybe what stage of the process they're in. But if you were interested in those services, you could certainly reach out and we could talk through that together. And then, you know, the other thing that we have on there, you know, is, you know, this monthly call, which is always a great resource for individuals. And then if you wanted to do a demographic research of your market, and you know, you're getting close to signing your lease and you're unsure, like, hey, is, you know, the density of this population in my area enough to support this, you know, lease, or the size of this location that I'm about to sign for, you know, we could do a deeper dive on the demographics and, you know, provide a market analysis for you in regards to that specific location. So you can find all that stuff on adcpro.com. Of course, you can go to our YouTube channel and stuff like that. But those are all different ways in which you could reach out and we could help you in that journey. And then, you know, later towards the middle part of 2026 is when we'll be launching our franchise, and you know, we can always have a discussion, you know, more about what an ActivAge franchise would look like and how we can help and support you. So those are all the ways that we can help now. At the end of the day, I'm just here to, you know, help grow. And, you know, I would love to see the adult day industry grow and become a bigger, you know, resource in the long-term care industry and serve more people. And so, you know, happy to help any way that we can. And those are the different options that we currently have. And if you haven't already, you got to get a copy of, you know, my book, The Great Care Crisis: Why the Future of Long-Term Care Starts with a Forgotten Idea. This book is just a great read. It talks about adult day. It talks about the problems with the, you know, longer term care industry right now, and where adult day's place is in that industry. And as I've always said, adult day is the future of senior care. So you can find all that information on adcpro.com. And I know we had to reschedule this call, so I appreciate you guys joining me today. We will do it again on the second Wednesday of October. So I'll send you guys out an email if you want to join that call. But appreciate y'all being here. Thank you guys so much. And we'll see y'all in the next one.
Thank you.
Thank you, Kris.
Thank
Thanks,
you.
guys. You all have a great evening, okay?
You too.
Thank you, Kris.
Take care.
Okay.